بسم الله الرحمن الرحيم. هنتكلم اليوم عن محاضرة Quality of Care in Maternity Services under supervision of Prof. Dr. أمل أحمد حسن عمران, Prof of Maternal and Neonatal Health Nursing, prepared by مروة قابل. Outline: Concept of quality health care, goals of quality in maternity health services, indicators for quality of services, elements of quality of care, application of component of quality in maternity room, structure of standards for quality of care, application of structure of standards for quality of care, general objectives, upgrade postgraduate student knowledge regarding quality of care in maternity services, increase their knowledge regarding utilization quality of care in maternity services. Specific objectives. At the end of this lecture, the postgraduate student will be able to clarify concept of quality of health care, understand the concept of quality health care, discuss goals of quality in maternity health services, identify indicators for quality of services, summarize the elements of quality of care, apply component of health in maternity room, illustrate structure of standards for quality care, apply structure of standards for quality of care. Introduction. Good quality care requires the appropriate use of effective clinical and non-clinical intervention, strengthened health infrastructure, optimum skills and positive attitude of health providers. This will improve health outcomes and give women, their families, and health care providers a positive experience. High quality care is integral to the right to health and the route to equity and the preservation of dignity for women and children. Concept of quality. The WHO definition of quality of care is the extent to which healthcare services provided to individual and the patient population improve desired health outcomes. In order to achieve this, healthcare must be safe, effective, timely, efficient, equitable, and people-centered. Another definition: quality is the ongoing process of building and sustaining relationships by assessing, participating, and fulfilling stated and inbuilt needs. The National Association of Quality Assurance Professionals defines the quality as the level excellence produced and documents in the process of patient care based on the best knowledge available and achievable to particular facility. Quality of health care is the degree of which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with the current professional knowledge. Operational definitions of the characteristics of quality of care. Number 1. Safe means delivering health care that minimizes risks and harm to service users, including avoiding preventable injuries and reducing medical errors. Number 2. Effective means providing services based on scientific knowledge and evidence-based guidelines. Number 3. Timely means reducing delays in providing and receiving health care. Number 4. Efficient means delivering health care in a manner that minimizes resource use and avoid waste. Number 5. Equitable means delivering health care that doesn't differ in quality according to personal characteristics such as gender, race, ethnicity, geographical location, or socio-demographic status. Number 6, people-centered means providing care that takes into account the preference and aspiration of individual service users and the culture of their community. Goals of quality in maternity health services. Number 1, providing maximum level of care to all pregnant women and their babies. 2, providing a higher level of care to those who need it. Number 3, obtaining the best possible medical outcome. 4, providing care that satisfies women and their families and care providers. 5, developing standards of care provided to all women. Indicators of quality of services: cesarean section rate, maternal death rate, prenatal mortality, instance of maternal and fetal health due to mismanagement of labor at any stage, incidence of unexpected complications such as rupture uterus, fetal distress, postpartum hemorrhage and cerebral hemorrhage, and instance of avoidable complications. WHO framework for the quality of maternal and newborn health care. Number 1, evidence-based practice for routine care and management of complication. 2, actionable information system. 3, functioning referral system. 4, effective communication. 5, respect and preservation of dignity. 6, emotional support. 7, competent, motivated personnel, and availability of essential physical resources. Element of quality of care. Donna Devon developed model to assess health care services by using the element of structure, process, and outcome as a way to evaluate the care provided. Number 1, structure. The concept of structure is considered to encompass the stable feature of the providers of maternal care, the tool and the resources at their disposal, and the physical and organizational setting in which they work. Type of structure: physical structure, for example, supplies, facilities, and equipment. Organizational structure, for example, setting. Administrative structure and staff structure, for example, human resources staff members. Number 2, process is defined as the set of activities that take place between the provider and women. It refers to the actual transaction in which the provider of care maker uses of the available structure elements. Number 3, outcome. It includes the 2 elements: the direct impact of treatment on the current or future health of the woman or her newborn, and the indirect impact on her satisfaction with the services offered and her health-seeking behavior. Safe passage of a woman through pregnancy, labor, and puerperium. secure delivery of healthy baby without any complication or hazards, improve reproductive health of women, services rendered at affordable cost. All women and their family are satisfied with care provided. Element of quality of care. This diagram clarifies the elements of quality of care component for three elements. Number 1, structure. Number 2, process. Number 3, outcomes. Application on component of quality in maternity room. Quality of structure, resources, location, antenatal, postnatal ward and unit and intensive care may be clubbed with the nursery pediatric ward in the inpatient area. Should include emergency delivery room and eclampsia room and each room and have oxygen and controlled temperature. Good ventilation and open place should be cleaned enough and wide. Number of labor rooms may be provided, at least 1 per 10 maternity beds and the delivery room have 2 beds. Number 6, provide network appropriately equipped health facilities able to provide basic emergency obstetrics room. Provide effective referral system. Build systems that be able to supply of emergency drugs and medical supplies. Ensure access to family planning and safe abortion services and post-abortion care. Promoting better researchers, monitoring and evaluating health services, remove barriers to access healthcare facilities. Quality of equipment of materials available. Availability of equipment such as examination tables with adequate light, bedside monitor, fetal Doppler, cautery machine, forceps, vacuum extraction, overhead light, crash cart, and equipment for operating delivers. Staffing. The department should be headed by senior experiences obstetrician. Nurses should be experienced and well trained. High qualified and periodic checkup. Quality of process. Antenatal checkup investigation should be carried out, screening for various diseases. The immunization protocol, precaution to be taken, the advice regarding diet, exercise, effects of smoking, drinking, and drugs on pregnancy. Protocol for assessing the risks and managing the risk during pregnancy, delivery, and after delivery through proactive to managing the risks. Protocol for special care for women with poor obstetrical or medical history, such as diabetes mellitus, for care and advice before conception and during pregnancy. Protocol for full verifying and adequate for couple about the maternal and fetal health. Procedure for obtaining informed consent on standardized forms. Quality of process. Number 6, provide network appropriately equipped health facilities able to provide basic emergency obstetrics room. Provide effective referral system. Build systems that able to supply of emergency drugs and medical supplies. ensure access to family planning and safe abortion services and post-abortion care, promoting better researches, monitoring and evaluating health services, remove barrier to access healthcare facilities. Quality of equipment and materials available. Availability of equipment such as examination tables with adequate light, bedside monitor, fetal Doppler, cautery machine, forceps vacuum extraction, overhead light, crash cart and equipment for operating deliveries. Staffing. The department should be headed by senior experienced obstetrician. Nurses should be exercised and well trained, high qualified and periodic checkup. Documented process for infection control. Protocol for effective management of complications such as the delayed labor, fetal distress, major complication during postpartum, protocol for ensuring availability pediatrician at time of complicated deliveries for immediate resuscitation, procedure for identification newborn baby, procedure for verifying couple at time of discharge, about care of mother and child, follow up, dietary advice, immunization and family planning, policy for protection and restriction unnecessary hazards, investigation such as x-rays, protocol for conduct abortion as pre-rules and regulations, procedure for maintenance of records and reporting of purses. Structure of standards for quality of care. On the basis of these findings for maternal and newborn care, a standard is defined as the description of what is expected to be provided to achieve high quality care around the time of childbirth. The standard of care has two main components: the quality statement and the quality measures. Quality statement sets out the requirements to achieve compliance with the standards, and the quality measures provide objective evidence for determining whether or not the requirements have been met. Statements are concise statements of priorities for measurably improving quality of care around childbirth, adapted from NICE quality standards. They define the markers of quality derived from evidence on the thematic areas and the resources required. Quality measures are criteria for assessing, measuring, and monitoring the quality of care as specific in the quality statement. They are of three types: input, output, outcome. Input means what must be in place for the desired care to be provided. For example, physical resources, human resources, policies, and guidelines. Output means whether the desired process of care was provided as expected. Number 3, outcome means the effect of the provisions of, and experience of care on health and people-centered outcome. Application of structures of standards for quality of care. Quality statement. women with preeclampsia or eclampsia promptly receive appropriate intervention. Rationale: pregnancy-induced hypertension, preeclampsia, and eclampsia are major causes of maternal mortality, stillbirth, and neonatal mortality. Prevention, early diagnosis, and timely appropriate treatment can drastically reduce the associated mortality and morbidity. Women with severe preeclampsia are immediately given intravenous or intramuscular magnesium sulfate and an antihypertensive as appropriate. A peripheral loading dose of magnesium sulfate should be given if the woman is to be transferred. Quality measures. Input: the health facility has supplies of oral and intravenous antihypertensive agent and magnesium sulfate available in sufficient quantities at all times in the antenatal, labor, and childbirth areas of the maternity unit. The health facility has written up-to-date clinical protocols on the management of preeclampsia. Those are available in the labor, childbirth, and postnatal areas of the maternity unit and are consistent with the WHO guidelines. Healthcare staff in the maternity unit receives in-service training and regular refresher session in the use of antihypertensive agents, intravenous infusion, and magnesium sulfate for treating preeclampsia and eclampsia at least once every 12 months. Output process: the proportion of all women with severe preeclampsia or eclampsia in the health facility who received the full dose of magnesium sulfate. The proportion of all women with severe pregnancy-induced hypertension in the health facility and received the recommended antihypertensives. The proportion of all women with preeclampsia in the health facility whose condition progressed to eclampsia. Outcome: the proportion of all women with the preeclampsia or eclampsia in health facility that did as the result of preeclampsia or eclampsia. The proportion of all women with the preeclampsia or eclampsia that arrived at the health facility with a live fetus whose baby did in the perinatal period, stillbirth or early neonatal death. The proportion of all women with preeclampsia or eclampsia in the health facility who experienced maternal near misses due to preeclampsia or eclampsia. The percentage of staff members in the health facility who meet biosafety standards when administering perinatal drugs. Thank you.